Hi, everyone, and welcome. We are so happy to have you with us today for our special webinar from IVF to Surrogacy, Understanding the Journey. My name is Elizabeth, and I'm a CRM associate here at ACRC Global. I work closely with our intended parents throughout their journey, and I'm thrilled to be hosting this session alongside today's expert speaker, Dr. Massie. And we'll be covering from the basics of the IVF process to common misconceptions to lifestyle factors and some of the latest advancements in the field as well. Our goal is to ask the questions that many intended parents have often asked us. So whether you're just beginning to explore your journey or you are already like halfway through the process, we'll walk you through and hopefully you'll walk away with a clearer understanding and some very valuable insights from Dr. Massey's experience. And we want to be informative, but also feel like this is a safe space. So if you do have any questions you want to ask during it, we do have a Q&A box. You could just type it in, and towards the end of our Q&A session, I will read through them. All right. And then before we dive into this discussion, I also wanted to let y'all know that if today's webinar starts any questions or you're feeling ready to take the next step, we'd love to connect with you one-on-one. We do offer complimentary consultations where you can speak directly with our team, learn more about the surrogacy process. And yeah, if you want, you can scan the QR code on the screen right now. You can also visit our website at acrcglobal.com. All right, and thank you guys again all for being here. Now let's get started. All right, so I'd love to introduce our guest speaker today, Dr. J.V. Massie from Pacific Northwest Fertility. It's an honor to have you here as a host. How are you doing today?
Thank you. I'm super excited to be here. I appreciate it.
Awesome. Yeah, so if you want to, I know we have some of your info on the screen, but if you want to give kind of a brief overview and introduction.
Sure. So, as you said, I'm an infertility specialist at Pacific Northwest Fertility in Seattle, Washington, where I'm also the director of our collaborative family building program. So, that's essentially, a big portion of my practice is helping people who are building their families through donor egg, donor sperm, and surrogacy, which we refer to as collaborative family building, or sometimes you'll hear it called third party family building. I've been with PNWF now for a number of years. I've been in practice doing special, fertility medicine now, gosh, going on 13 and change years. So I've been doing this for quite some time. I served in the military for a number of years as a fertility specialist, and so came to my civilian practice a little bit later, but have just really thoroughly enjoyed this part of fertility medicine. I just think it's such an incredible and beautiful way to build your family. I
Yeah.
really love it.
And your journey is also super cool going into the military and then
Yeah,
doing this now. It's really awesome.
absolutely. Yep. I went to medical school on a military scholarship, and so
Oh,
paid back my military scholarship with 7 years in there. So,
wow.
yep. So got to practice fertility medicine and OBGYN and really serve a population of people that I admire and really respect and adore. So that was wonderful.
Awesome. All
Yeah.
right. Well, yeah, now let's go ahead and shift into our kind of Q&A session where we'll dive into some of the most common questions we hear from intended parents, exploring kind of surrogacy and fertility. So for the first question, kind of leading into your experience, can you start
Yeah.
by sharing a little bit about, maybe you already shared a bit about your background, but what
Yeah.
initially has inspired you to become a fertility doctor?
Yeah. So I actually weirdly have wanted to be a doctor for as long as I can remember. So even when I was really tiny, I have this memory of wearing my mom's robe and walking really fast up and down the hallway of our house, pretending like I was wearing a white coat and like going from, room to room. I decided I wanted to go into reproductive medicine also really early. It was when I was about 13 years old. I actually babysat for a family that had a small child, and they asked me one day if I would mind staying with their kiddo for a few days because the mother needed to have a surgery. And in talking about the surgery, it came to light that the surgery was being done to save her uterus. And she said to me, on her way out the door the morning of her surgery. I'm terrified, but my family's not complete. And I have to do this because I know that there's someone else who's coming. And it really struck me in such a profound way. And really decided at that time, even before I had a real clear concept of what reproductive medicine meant, that I really wanted to work in that population, that's really what I wanted to do. And so went to medical school with the intent that I was going to go into OBGYN, went into residency with the intent that I was going to do infertility medicine, did my training at Stanford, both for my residency and my fellowship. And really that's been my passion ever since.
Yeah, that's awesome. And can I go into our second question for intended parents who are new to IVF and surrogacy? How would you describe the IVF process in simple terms?
Yeah. So the simplest way to describe it is just the creation of an embryo by joining sperm and eggs outside of the human body. Right? In the simplest terms. The process, a little more detailed than that, is essentially using hormonal medicine to stimulate the ovaries to recruit and grow multiple eggs at one time. Those eggs are then collected in a short outpatient procedure. They are joined with sperm within the lab, and then the embryos that result grow in the lab for about a week. And then those embryos that are created can then be used for embryo transfer into the uterus.
Yeah, and what are some of the most common reasons that patients turn to IVF as part of their, family building journey?
Yeah, so I think the kind of three most common reasons is one, infertility. So the inability to conceive on your own for whatever reason, whether that be sperm factors, egg factors, hormonal factors, etc. The second is wanting to do genetic testing on embryos in order to prevent transmission of significant or serious genetic illness to a child. And then the third is for individuals or same-sex couples who need gametes or a uterus in order to successfully build their family. So kind of three big categories of people that we see.
All right, and then for the fifth question, what are a few of the biggest misconceptions about IVF or surrogacy that you often hear from intended parents?
Yeah. So I think it depends on there's some positive misconceptions and there's some negative misconceptions. So I think the most negative misconceptions are that IVF and surrogacy in particular are uncommon. It's actually an incredibly common way for people to build their family. The estimates now that are that between about 500,000 to about 750,000 children are born through IVF every year now, and that number is just going up and up. And about 5 to 10% of those are surrogacy pregnancies. There's not a great way to track those numbers, but the estimates look like it's a pretty good proportion of those children. And so I think probably the biggest negative thing that people hear is that this is uncommon, that this is unusual, that this is right, that this is not a normal way to build your family. And that is completely untrue, right? Completely untrue.
Yeah, we get some intended parents that, they feel alone because they think that it's, uncommon to go through this.
Absolutely.
So, yeah, I think it's really
Absolutely.
important for them to know that it's very common.
Absolutely. Yeah. And I think we're getting better, as a society about talking about this. And so hopefully people are starting to feel less alone in the process, and there are more and more ways to connect with other individuals who are traversing the same path that you are, which I think is really beneficial. But it definitely still feels like there's some stigma or quiet around it when it is such an incredibly common thing.
Mhm. So, all right. And then for the sixth question, how important is lifestyle, like diet, exercise, and stress? How's that going into preparing for IVF?
Such a good question because it comes up all the time. So I tell my patients, your reproductive system is just like any other organ system in your body, right? It responds well to healthy choices and actions. So eating a healthy diet, and healthy diet sort of in our world means, lots of fresh fruits and vegetables, lean sources of protein, good healthy fats, avocado oil, that sort of thing. Appropriate supplements for your area, right? Here in the Pacific Northwest, we don't see a whole lot of sunshine for a good portion of the year. So we recommend a lot of our patients be on vitamin D, right? If you're a person who's going to be carrying a pregnancy, taking a prenatal vitamin with folic acid is really important. I think sperm sources are often neglected, right? We want our sperm providers to be on a daily multivitamin. There's evidence that things like CoQ10 and zinc can be beneficial for them as well. So I think all of those things are really an important component to optimization of your health. Moving your body in a meaningful way. That's 30 to 40 minutes of moderate intensity of activity 3 to 4 times a week. Trying to manage stress. I say that carefully because yes, exactly, right? There's no way to alleviate stress from our lives. My goodness, the modern life is so incredibly stressful. There's really no way to eliminate it. So it's really about taking steps to try and manage it, right? And that looks different for every person. Some people really enjoy things like yoga and meditation, kind of are more standard, approaches to stress relief. Some people like doing more intensive exercise as a way to manage stress. Some people just want to go out with friends and family and have that support. And so it's really not about alleviating stress. It's about finding ways to manage it. And we know that people who are able to manage their stress actually do better, not necessarily from an outcome standpoint, but just from an emotional standpoint as they go through this fertility journey, because it is a lot, right? It's a lot of ups and downs. There's lots of excitement. There's lots of sadness in some of these journeys. And so being able to have systems in place in order to manage that stress can really help you navigate that in a positive way.
Yeah. And I think having a good IVF clinic to support you as well, and not
Absolutely.
you don't have to worry about the little details is very important.
Absolutely. And I would say that on the flip side as well with your surrogacy agency. We talk about how logistically complex collaborative family building can be. And so there is always this piece of, am I waiting for that? Is somebody waiting for me? Am I doing right? You're always,
yeah,
you're always trying to think am I on top of it? Am I doing what I'm supposed to be doing in order to keep the process moving forward? And I think if you have a surrogacy agency and a clinic that not only communicate really openly and well with you, but also really openly and communicate well with each other, really alleviates a lot of that, underlying anxiety.
Yeah, and we have a case right now with you guys, Pacific Northwest Fertility, and you guys answer emails so quick. It's so easy to collaborate with you guys as someone who is constantly. Sometimes I feel bad for checking in too much, right?
No.
But it's so awesome to work with a clinic that also reciprocates very quickly and is very thorough and detailed.
Thank you. Yeah, it's such an important part of the process. There's so much I think that and so much you don't know. That just in and of itself, right, lends itself to being super nervous about the process. And so working with people who are open and communicative and transparent is just so critical to the whole process.
It really is.
Yeah.
Right. Well, on to the 7th question. What are some of the latest advancements in IVF that are helping intended parents or surrogates today?
So I think the biggest one is sort of a more global one that I've seen evolve during the course of my career, which is the quality of what happens in the embryology lab. It used to be, when I started my residency and my fellowship, that the goal was to get embryos back into the uterus as soon as we could. Right. So we would fertilize them, and then 2 or 3 days later, we were putting embryos back into the uterus. And as a result, an analogy I use all the time is like a marathon, right? At the beginning of the marathon, everybody looks about the same, but at the end of the marathon, really only the very best runners are the ones that hit the finish line right first. And so embryos are very similar. At the beginning, embryos all look very much the same. It's really hard to know which of those embryos has the highest potential to result in a successful outcome. And so in the earlier years of my career, we were putting embryos back 2, 3, 4, sometimes 5 at a time just because we had to do it in order to have some reasonable chance that one of those embryos would work, right? And so as a result, not only were our outcomes lower, but our risks were higher, because we all know, right, that multiple gestation is the riskiest thing that we do. And so in the course of the last 10 years, the embryology lab has just become brilliant. They are so good at culturing embryos that now we can very comfortably wait until days 5, 6, and 7 for embryos to develop. We can wait to the end of the finish line at the marathon, right? And it can help us to pick embryos that are most likely to implant and grow, which also then allows us to transfer embryos one at a time, right? Which is the safest thing that we do for our surrogates and for our, intended parents.
Yeah, we still get sometimes, and also maybe it's just older family members of mine too, that'll be like, wait, I thought you're still like transferring like, yeah, 5 or 6 embryos.
Right?
Yeah, and we'll have also intended parents ask that, and we have to explain, no, technology has luckily improved so much since then.
Yeah, it's absolutely brilliant. It's absolutely brilliant. And, we're constantly looking for what's the next thing that can help even more, right? What's the next test that we can look at that can help us determine quality and potential before we put those embryos back into the uterus. And so it's a pretty amazing part of our field that I think just continues to evolve and evolve year after year.
So, right. And then for our 8th question, how do you typically support intended parents emotionally and medically throughout the IVF and surrogacy journey? I know it's a broad question.
Yeah, it is, but a good one. I think, building your family is the most intimate thing that you will do, right? As an individual or a couple. And there's some real basic unfairness to have to ask anybody else to be involved in that process in any way. And so I think it's really critical that people work with teams, their agency, their clinic, that really understand and respect that piece of it. And so we've talked a lot about communication and about transparency. And I think, those are the ways that we emotionally support our patients going through this process, is just really a healthy respect for what we're allowed to participate in.
Great.
A really honest understanding of how terrifying that can be and how much trust goes into that process. And really just trying to keep very open lines of communication available for our patients. We have lots of emotional support resources for individuals. We have a support group through PNWF. We have a list of mental health professionals who work a lot with patients who are building their families through IVF practices. But even outside of those more formal pathways, we really see our job as giving people, daily support as they need it, as you go through the process.
And I'm gonna, I guess, skip to a question I think relates a bit more to this. Yeah. So how do you help patients set realistic expectations about IVF outcomes?
Yeah, this goes back actually, I think, to one of the earlier questions about what are some of the common misconceptions about IVF. And I think one of the negative misconceptions about IVF, or that I would consider a negative misconception about IVF, is that IVF works all the time. And that is definitely not true, right? There are medical scenarios in which IVF cannot be successful, right? The one that comes to mind most that I think we see the most sort of in daily practice is very advanced ovarian age, right? Because we are born with all the eggs we're ever going to have, and they age right along with us, and they're exposed to all the stuff that we're exposed to, not to mention driven by our genetic history. There comes a time at which even IVF cannot translate into positive or successful outcomes, right? That's true with sperm sources who there are no sperm, right? Or some of those more subtle and less explainable conditions where people just can't create embryos that are healthy. And so I think with each individual, it's about looking at all of those components, all of those factors, right? And then saying, based on this assortment of things, this is what your success rate looks like. Right. And we as a group try very hard to be realistic and hopeful at the same time. Right. There are not many circumstances in which the chance of success is 0. But we also do not want you to go into a process thinking that your success rate is going to be 80% when the realistic thing is that it's more like 2%. And so I think for us, it's really about, setting people up with information so that they can then be empowered to say, yes, that feels like an appropriate choice for me, or no, it doesn't feel like an appropriate choice for me.
Yeah, give the intended parents the power to decide.
Absolutely. Absolutely. Right. Some people look at a success rate of 5% and say, that doesn't feel worth it to me. Right. That doesn't feel worth the time. That doesn't feel worth the emotional investment. And some people look at a 5% success rate and say, that feels good. Let's give it a try. Right. It's worth it. And there's not a right or wrong answer there. It really is just about your own personal situation and your own interpretation of risk and benefit.
Right. Yeah. Well, kind of switching gears now. How does IVF fit into the path for same-sex couples or single parents by choice who are also exploring surrogacy?
Yeah. So a critical part of the process, right? For most individuals who are doing this. So it means, so I guess we should categorize kind of different groups too and how it relates. So same-sex male couples, IVF is always part of that process, right? Because you are needing an egg donor, you're using usually a partner sperm in order to create the embryos, and then you need a uterus in order to transfer those embryos into. That's also true for single male people who are building their families. A little bit different for our same-sex female couples, right? Because they have a uterus and they oftentimes have an egg source, sometimes building their families can include things like intrauterine insemination. So you don't have to utilize IVF at all. So it sort of depends on your own anatomy, right? What you do and you do not have available, both within yourself and in your partnership. But for all surrogacy partnerships, IVF is required because it's the method that we use in order to create embryos in the lab. Those embryos are frozen and then they are available for when your surrogacy partnership is solidified and that surrogate is ready to have the embryo transferred into the uterus.
Gotcha. All right. Yeah. And what role do genetics and screening play in IVF today?
Yeah. So kind of a 2-part question. There's really 2 categories of genetic screening that we can do during this process. So I'd love if we have time to kind of talk about them both.
Of course.
Okay. So the first one happens before embryos are created. And that's something called expanded carrier screening. So that's a kind of a basic panel of mutations that the egg source and the sperm source can be tested for to make sure they don't have any mutations that match each other, right? So there are many, many mutations that exist that if you only have one copy of that mutation, you are a healthy, normal individual. Right? Mutations are common. They're just part of being human. But if you have an egg and a sperm source that both have the same mutation, then the chance that the embryos they will create will actually have that genetic illness is very high as 25 to 50%, depending upon what the mutation is. And so that is really important for 2 reasons. One is that if you're using a donated sperm source or a donated egg source, you don't want to pick a donor that matches you, right? So you can look at your panel, you can look at your donor panel, and you can make sure that you don't have any matching mutations. If you and your partner are creating embryos together and you're both a carrier of a mutation, there's actually a way through IVF that we can identify which embryos are affected, right? So let's say that you're both carriers of muscular dystrophy. Right? You could then opt to have your embryos tested for that mutation and then preferentially transfer embryos that are unaffected. Okay. So pretty cool. So that's kind of a general umbrella of things that you can do. Kind of on a side note to that, if you have a personal family history of something, for instance, let's say that you have a very strong family history of breast cancer, and you are screened and found to be a carrier of the BRCA mutation, right? You can also use that information. Again, we can create a probe for embryos, and we can screen embryos for that specific genetic disease. So I had mentioned earlier, one of the components, one of the groups of people that we see who do IVF are people who are trying to prevent transmission. And so that's where that comes in.
Yeah, that's cool. I didn't even know about seeing the embryos with
Yeah, absolutely. So it's a pretty amazing piece of technology that we can do to really help to optimize the chance that pregnancies will be healthy. The second part of testing is testing or screening that's done on the embryo itself, and that's called PGT, or pre-implantation genetic testing. And I think lots of people, particularly people going into surrogacy, have heard about this, right? Because it's something that comes up, I think, a lot. PGTA is just a biopsy that's done of the embryo right before we freeze it. And it's a screening test, essentially, that tells us whether embryos are likely or unlikely to have the correct number of chromosomes. Random chromosome number error is the primary reason why miscarriages happen, and the primary reason why embryos may not implant and grow. So by doing this screening test, it essentially helps us to prioritize the embryos that have the highest chance of implantation and ongoing pregnancy for transfer first. Okay. That becomes an important conversation always, but even more so in surrogacy partnerships, right? Because we really do want to optimize the chance that that very first transfer is going to be a successful one, right? These are long and expensive and involved processes. And so every step that we can take in order to optimize the chance that every transfer is going to have a successful outcome becomes worthwhile. So the conversation about PGT screening is something that we have, that's a conversation we have with all of our patients. And I'm sure it's something that you guys have come up all the time when people are pursuing their surrogacy partnerships as well.
Yes, especially with the surrogates, with are they okay with, termination or
Absolutely.
and all of that. So yes, it's very important for them to know up front, right? Even before they find a surrogate.
Absolutely.
On the same page.
Yep, absolutely, absolutely. And how strongly we recommend PGTA varies a little bit based on things like what's the age of the egg donor, right? Because we know that if the egg donor is young, that the percentage of embryos that are going to be abnormal is much lower. Where if the egg source is much older, right, we can see abnormality rates as high as 80 to 90% in some cases. And so just a really important thing to put on your list of when you talk to your physician, when you talk to your clinic, right? That's a conversation that you definitely want to have.
For sure. Right. And then for our 13th question, what is something people often are surprised to learn about IVF or the surrogacy process?
Yeah.
I
think the most surprising thing about surrogacy partnerships is the time. These are long journeys, right? It generally takes, anywhere from about 6 to 12 weeks just to get embryos created, right? With free cycle testing and getting medicines and getting your stimulation medicines on board. And then match times for surrogacy agencies vary, but generally can be anywhere from about 3 months to about 24 months, depending upon the agency, right? And what their particular screening and wait time process looks like. So we always are telling people when you start this journey, you're really, you're planning for baby in 2 years.
Yeah.
And year and a half to 2 years. And I think that is striking.
Yeah.
Some people, yeah.
I think especially too with our practice, like the legal process too.
Yes.
People forget to consider that.
Yes.
It takes a large amount of time, right?
Huge. Yes. I'm so glad you brought that up. Absolutely. It's such a critical piece and it does take time, right? And if you're an international family, you're oftentimes working with lawyers, both stateside and then in your country of origin. And so that absolutely is a piece that takes time that you don't always factor in.
Yeah. I totally agree. We get people that come in that are like, all right, like let's
Let's
find out
go.
next week. Not exactly.
That's not exactly how it works. Yep. And so I think the other thing that's just important to know about that too is that it's okay too to chunk it out, right? To do it in pieces. And so we oftentimes are seeing people now so forward thinking about their family building where they're creating embryos now because they know that they're going to want to do their surrogacy partnership in 2 years or in 3 years, right? And so they're taking advantage of their young age or their financial situation or their insurance right at the moment and saying, okay, we're going to use this time to get our embryos created. But we know we're going to be planning out for that surrogacy part of the journey down the line.
Right.
Which is great. Yeah. And you were going to say something, but I just wanted to say too, that on that same note, one of the things that often comes up, at least in my patients, is when do we partner with our agency, right? Do we wait until we're ready to do it? And my advice, and you can tell me if you tell people differently, I always tell people it's great to know who you're going to work with early because your agency is the people, they're going to know what your wait times look like. They're going to be able to give you an estimate, right, of timelines and costs. Those are the people who are really going to help guide you through that matching part of the process. And so even if you're not planning on building your family for 2 years, it's great to just set up that relationship so that you can keep in touch, right? And say, okay, we're thinking it's going to be 2 years. When do you think we need to go on the match list in order to really meet that timeline goal?
Yeah, no, I totally agree with you. Even if like they are looking at in a couple of years starting, it's still always good to start getting in contact and even have like that first consultation, right? Of telling them how the
Absolutely.
process goes. It's, it's good for them to start getting knowledge as soon as possible.
Absolutely. Yeah, absolutely. I agree.
Right. And we have one more question, and that's going to be, is there a story or a moment from your career as a fertility doctor that has really made an impact or stood out to you?
Yeah, the honest answer is so many. There are so many, I think we all probably in our careers have those experiences that really stand out to us. Um, but in our world, we get them a lot, which is really a gift, to have so many successes. I think everybody remembers the very first couple that they did an embryo transfer for that was successful, because I think even though scientifically we know it's going to work, to see it actually work is really remarkable, and it remains really remarkable. I'm always surprised that people can ever get pregnant on their own, because there's so many things that go into it. So I wish I could pick out one particular story, but honestly, my whole brain is just a mishmash of, thousands of patients that I've had the opportunity to work with who have shown such, you know, calm and strength and fortitude in pursuing their plans for family building, their desires for family building. And I was just talking to a patient the other day, from an emotional standpoint. They've done studies that look at the emotional impact of infertility in particular, and have shown that the emotional turmoil that you go through is the same as if you get a cancer diagnosis.
Wow.
And I think people really underestimate and dismiss that. We feel like as a society, rather than rallying around people who are trying to build their families, right, people feel like they have to be like, no, it's okay, everything's fine, I'm fine, it's gonna, right. And so I just am constantly inspired and awed by the strength of people as they go through this process.
Yeah,
It's really an amazing thing.
I totally agree with you. It's really, it takes a lot of energy and bravery to go through this process, and, knowing that there are, there are risks, might not always work
Yeah,
out, but still,
absolutely.
wanting to persevere anyways it's really
Absolutely.
beautiful.
Yeah, it really is amazing.
Awesome. Well, let me see if anyone had
Yeah.
anything in the chat. Oh, someone said yes, Pacific Northwest Fertility response. Real quick. Professional information sport.
Thank
I second
you.
that.
Thank
They're
you.
on
Thank you. That's our goal.
it.
Yeah.
All right, and if anyone still has any questions, you can still put it in the chat.
Oh, I think there's one here that says, what's the success rate for IVF? That is a
Oh,
great question and sort of a broad one, honestly. So the success rates, like I said, really depend upon a number of factors, right? Sperm quality, egg quality, particularly age of egg donor, and uterine factors. So it's pretty specific to your scenario. I will say when we look at outcomes for donor egg surrogacy partnerships, that's generally where we see our highest success rates, and the live birth rates are around 75 to 80%. We can have success rates that are obviously that are much, much lower than that. You heard me say 2%, 1%. Those are numbers that we sometimes see in people who the egg source is an older individual who have had a history of poor outcomes with IVF or embryo creation. So really important to ask that question specifically for your circumstance and your clinic, because the success rates for clinics also vary. And so those are two really important piece of information, is to ask for your lab, what do your success rates look like? And for us individually, right, what would you quote our success rate to be? And if they either can't give you that answer or the answer doesn't make sense, if you hear somebody say your success rate is 95%, that actually that's not true.
Yeah.
The numbers don't ever get that high. Those should raise some flags for you, and you should ask more questions.
Yeah. That's right. Thank you for catching that.
Absolutely.
I was in the regular chat. So
yeah, I was in the other box. So
if anyone has more in the Q&A or regular chat, feel free to share them. But yeah, I'll just move on to the kind of closing out. Okay, all right. So thank you guys all for joining us today. And a very big thank you to Dr. Massie for sharing such valuable knowledge and information with us. And it was great to, talk about your perspective and what you do at Pacific Northwest Fertility. We really appreciate it here.
Thank you.
And yeah, just to everyone else, remember, you don't have to navigate this journey alone. Like we're saying, it's very emotional. And so our team and Dr. Massey's team is here to support you any step of the way. If you have questions after this and whatnot, you can reach out to us. And kind of segueing into that, if you want to connect with us directly, ask follow-up questions, schedule free consultation, our contact information's on the screen here. And Dr. Massie, if you have information that you would love to share.
Yeah, so you can reach out. Probably the best way to connect with us at PNWF is through Molly Hike. She's our patient outreach coordinator. She's going to put her email in the chat box, but I'm also going to read it out loud in case you're listening to this online afterwards. So her email address is mhuyck@pnwfertility.com. So mhuyck@pnwfertility.com. You can also go to the PNWF website if you'd like to schedule a visit, but emailing Molly is a great way to quickly get someone on our team.
All right, and then someone said in chat, thank you, Dr. Massie, and for being here. And yeah, on behalf of all of us here, thank you again, and we wish all of you the very best on your path to parenthood. So yeah, take care and goodbye for now.
Bye, everyone.
Bye, I'll see ya.